So my name is Dr. Frances Cervoni. I am a stem cell fellow at MD Anderson and previously did a myeloma fellowship at MD Anderson as well. I'm here to talk about my current research on the impact of ethnicity in the outcomes of newly diagnosed myeloma patients who go on upfront autologous stem cell transplant. In this study, we look at a cohort of patients over a span of over 10 years that were treated at MD Anderson and who receive autologous stem cell transplant upfront. These patients were over 1,900 patients. We looked into the impact of their ethnicity background, separating them by Caucasian group, African American, and Hispanics. What we found was that patients who were of Hispanic origin were greatly affected, more so than African Americans and Caucasians, when it came down to the outcomes of myeloma treatments. All these patients underwent transplantation up front, and even though they underwent transplantation up front, the patients of Hispanic background were observed to have lower overall survival and also progression-free survival, which compared to their counterparts. Globally, those of minority origin, both African American and Hispanics, were more affected than their Caucasian counterparts, and more is to be elucidated into why this is occurring. It's not just a single factor in disparity, it's a factor of also the genetics of the disease, the treatments that these patients received prior to transplantation, the measurable residual disease before transplantation. Was it profound? Was it MRD positive disease? And also, were these patients post-transplant on maintenance therapies? In this study, one of the things that the key components that we looked into in both univariate and multivariate analysis was the presence of renal dysfunction that may have been present even before the disease was occurring. And what we found was, in Hispanic patients, interestingly, renal dysfunction was a bit more so present, and there was a significant difference between the groups, although the creatinine values, when we looked closely, kind of were similar, but the outcome and the impact of the renal function actually affected the overall survival in the end. So we do think that baseline comorbidities do have a significant impact. What can we do to address those comorbidities comes down to screening early on in early years and more education to patients into the importance of diet and good health screening that has nothing to do necessarily with the myeloma diagnosis, but that could in fact impact that end organ damage from myeloma long term and affect those outcomes. I don't have objective data to say that. These patients, a lot of them were not necessarily treated at MD Anderson, right? They came from outside oncology offices and then pursued transplantation through our division. There is a large possibility that could be occurring because myeloma, amyloid disease, these plasma cell dyscrasias tend to be harder to diagnose up front, right? So patients go to a general doctor's office and they see a little bit of anemia. Well, they might be thinking it's an anemia of chronic disease. And they see a little bit of a creatinine dysfunction or renal dysfunction, but they're not necessarily putting all of these puzzle pieces together early on until the presentation is a little bit later in the diagnosis. So it is a very high likelihood that that could be occurring. One way we can do this is by educating the community about myeloma. It is a lower that is a prevalent disease in malignant hematology, but it is a disease that has a chronicity in the body of the patient, right? It's a chronic illness that currently is considered incurable. I'm hopeful that it will be curable one day, but that affects our patients in such a way, the burden of the economical burden, right? The burden of the disease itself and the family and the patient, that the earlier we diagnose it and the more we can attack this disease so that the patient has a better quality of life, I think would be one of the key components. I think the outlook in myeloma nowadays is very promising. I am very excited to see more inclusiveness of patients of underserved minority backgrounds being included in the clinical trials. And I exhort every single patient to, when they go to their doctor's office, ask if they have knowledge of clinical trials or visit clinicaltrials.gov and see what trials are available that might be close to them in a cancer center, because that's probably their best upfront option if they're newly diagnosed, and it will be the best way to move the needle forward in this disease process.